I sound much better, right? Yes. Because your guests will feel like you already got TV show ticket already a few days ago. Please let us have our seats. Dr. Louis Porto, Minister of Health, and other officials of government present, our WHO representative, our USAID, our health partners, the program manager, and staff of the National Tuberculosis and Leprosy Control Program, our esteemed local and international partners, our dedicated health workers, our Liberia, our dedicated community leaders, all the recipient people of Liberia, and even our students, members of the press, distinguished ladies and gentlemen. Today, we stand united under the banner of hope and determination as we commemorate World TB Day together. I'm saying together, because we are all here in one accord. Clap for me now. That global saying, yes, we can end TB, and our local slogan, working together, we can end TB, and not merely a rally cry. They are confirmation of our collective resolve. On this day, we unite to raise public awareness about the impact of tuberculosis worldwide, a disease that has burdened humanity for far too long. When I was coming as a young girl, we heard of someone with TB, you ran away, right? But today we all live with each other. That is a great step forward. On this day, we unite to raise public awareness about the impact of tuberculosis worldwide, a disease that has burdened humanity for a very long time. This issue is particularly pressing in Liberia. Hello? TB is still here, right? So if we do not obey our health workers, we can just end up paying the TB index. And we dare not do that, right? This issue is particularly present in Liberia, where our struggle for tuberculosis is intensified by poverty, limited healthcare infrastructure, and the aftermath of past crises. We can attest all to that. Our beloved country, the skies of hardship are evident, but so is the unyielding courage of our people. Our people are determined that TB has to get out of Liberia, right? All right. This courage has driven the National Leprosy and TB Control Program to work tirelessly, and I mean tirelessly, because I can attest to that. A few months ago, about 8 to 9 months ago, I had 2 persons in our compound. They were managing a generator, and guess what? They came down with TB. And unfortunately for one, he decided that he was being bewitched. So guess what? He ran away and he went to Guinea. And the rest is history. Because actually they said he had died from TB. But the other one stayed. And I insisted, I even fought him to get to the TB analyst. Because I had worked at Firestone Hospital for 7.5 years. And I knew that TB could be prevented and cured. So I was able to convince him to go and take his treatment. And today, he's back on TB. So I just want to say thank you. Those of us who have challenged this disease, it has to go. Then Mother Boakai said, TB has to what? Amen. It is appropriate at this moment to reflect on the gravity of the situation that tuberculosis presents, not just globally, but here in Liberia. The World Health Organization estimates that 2 billion people are infected with TB bacilli worldwide, and each year, 10 million fall ill with TB disease. 10 million, not 1 million, 10 million. Can you imagine that? A huge number of these cases occur in less developed countries, including Liberia. We are one of the 10 high-burning TB countries with an incidence rate of 308 per 100,000 population and a frequency rate of 510 for 100,000 population. Oh, that's a huge number, right? For a small country like us. But the good news is the fight against TB is a battle against a disease that is both preventable and treatable, right? We can treat it and we can kick it out. Yeah. Yet every day, over 4,100 people die from TB, and nearly 30,000 fall ill with this disease. I don't care how we keep it or it's still around, so we have to work a little harder. These are not just figures, my audience. They represent individuals, fathers, mothers, and children. Each loss creates a ripple effect throughout our communities. Every time someone dies from TB, we get afraid. We are scared that we may be the next. So let us know that we can get rid of it. And we in here are going to hold you responsible if we leave from here and I hear that anyone in your community has died from TB. Because from here we're going to start classes to educate ourselves. Amen? Our healthcare, listen to yourselves now, we both still money. Our healthcare workers strive tirelessly, but they face immense challenges in extending TB intervention to all of our population. With the burden of HIV and AIDS on the rise, we struggle with adequate TB diagnosis and treatment. Our country's TB treatment success rate stood at 76% according to the 2023 Demographic and Health Indicator Survey. This is a proof of the dedication of our health workers and the determination of our people. However, we cannot afford complacency. We must strengthen our resolve to improve these success rates even further. 76% is still too low. We've got to work harder to carry up to at least 90%, right? If you are big clap for me. The death by 95 and close to 90% between 2015 and 2035. This goal is achievable through collective action and sustainable investment. If we work a little harder, we can do it. As we face not only the disease, but also the economic strain it places on our families, it becomes clear that no one should have to bear extremely high expenses because of TB. This highlights the urgency of our mission today to ensure that no family is burdened by such costs. This is a health imperative as well as a social economic one. We must work to prevent TB from pushing our people into poverty due to loss, income, transport costs, and other pocket expenses. We should not let a broke pocket keep us from taking our treatment. Okay? To the citizens and residents of Liberia, including myself, talking to us now, I call on you to take action. If you or a family member show early signs of TB, such as coughing, these are the symptoms present now, such as coughing, night sweats, weight loss, or fever, see medical attention. So don't go and say, when you is symptoms, whether they not tell us. As soon as you start noticing them, well, make sure you run there and say, bring them to TV and adherence treatment is crucial. Completing TB therapy is essential for both personal recovery and the health of our community. Health workers, talking to you. Health workers, please maintain vigilance and wear masks. Please maintain vigilance and wear your mask. I also implore everyone to avoid crowded places where the risk of transmission is very high. Despite the odds and the daunting figures, let me reassure you that we have seen successes when you play with it. Okay? Where are we? Small. Let us celebrate our successes. I come now to boasting. As your first lady and mother, I am committed to supporting and because the health of our nation is the wealth of our future. If you do not carry anything home, you remember this one. The what? The health of our nation is the wealth of our future. Okay? As a mother of this man again, hello. I call on all of us to confront the challenges that hinder our progress toward eliminating this horrific disease. Limited resources, social stigma, and complacency. Listen, complacency. We satisfy with the situation, whether TV goes or not. We are Liberians, we live here and we stay here. That's complacency. Complacency is one of my achievements. Yet, listen to me. Yet, as the lesson that the Lord wants to us, and I quote, it always seems impossible until it is done. It always seems impossible to cure TB until the relative is cured and is back at home. Yeah? Let us draw from our own Liberian history, reminding ourselves that no mountain is too high when our will is strong. If we are strong to keep TB out, TB must go out. Even in these challenging times, our results remain firm. However, achieving our goals requires broad courage from leadership, from governments to grassroots organizations. Increased investment is essential. Without funding, progress cannot be sustained. Progress cannot be sustained if we are not we are not being funded. I am committed to advocating for this cause to ensure our fight against I know you hold I am committed to advocating for this cause to ensure our fight against TB receives the attention and resources it deserves. The theme of this year is Old and Soka. Hello, I hear you but it is more than the one slogan. It is a call to action that requires high-level leadership. This new government, though young, is dedicated to that call. I want to vote with the vote. We understand that increased investment, both financial resources and human commitment are critical to our success. The recommendations is not merely an option, it is an imperative, a must. We must do that. We are committed to supporting the implementation of innovations to make TB treatment and prevention more effective and accessible to all Nigerians. We cannot do this alone. As Henry Keller once said, and I quote, alone we can do so little, together we can do so much more. This spirit of togetherness has brought us this far in our fight against TB. Multiple sectorial collaboration is a cornerstone of our strategy to combat the TB epidemic. Public and private sectors, civil society, communities affected by TB, and healthcare providers, we all have a role to play. And every contribution brings us one step closer to our goal. We all have a role to play. We cannot sit back from TB and you say, I will do nothing. Somebody finish wishing my child. No one wishes anyone when it comes to TB. All we need to do is seek, take care, and will be made available. In this manner, I want to say I'm very proud of health workers. We are struggling to health workers, and I'm proud of you. The reason why I'm proud of you because you, my own self, as a administrator for Pfizer Hospital, I used to be afraid when the nurses can say, oh mom, that patient in there so has TB, and me, and I'm going. I had to read on it before I found out that there was cure. So I'm very proud of you. Like you did not have to read when you knew it would go away. So thank you so much. As the African prophet goes, if you want to go fast, go alone. But if you want to go far, go together on call. In Liberia, we choose to go very, very far. That is why we are here today. Because we want to know how fast we can go. And because you are here, I'm sure after this, you'll try to go and see how fast you can go in order to bring this sickness to an end. To this end, my office will commit, I'm hosting again. To this end, my office will commit to supporting initiatives that increase awareness, improve access to treatment, and foster the necessary behavior change in our population. We will advocate for the strengthening of our healthcare system to ensure that every TB patient receives the care they need without suffering financial hardship. We engage with partners. Listen how we do it. I didn't say we're talking about the President Boakai band, but we engage with partners within and beyond the health sector, including social protection, labor, immigration, and just a comprehensive response to this epidemic. Today, I call on every citizen and resident of Liberia to join me in taking decisive action. I said, ESO, actions, not just one, but one actions. We have to move. This country has to move. We can't be among the 30th. No, I'm be among the 5th, right? Today I call every citizen and resident of Liberia to join me in taking decisive action. We must update those among us who are affected by TB and ensure that they do not face this challenge alone. We must recognize any symptoms and seek treatment without delay. We must adhere to the full course of treatment prescribed to us. We must take our health and the health of our communities into our own hands by practicing preventive measures and attending regular health facility visits. We must visit those facilities that can provide treatment for this sickness. It must go. Yeah. And it's very special word, TB Day, with a big victory to announce for our country. I am filled with a profound sense of gratitude and boasting. When you see me doing so, I'm boasting. I am filled with a profound sense of gratitude and responsibility bestowed upon me by the Health Minister, Dr. Louis Koto. You want me to post the book? It is with great pride and a sense of shared responsibility that I stand before you. I'm already standing, so I'm standing here. And I stand before you to symbolically dedicate 4 groundbreaking artificial intelligence AI X-ray machines